And of course, some sirens just started in my neighborhood, so sorry if you hear those, y'all. My name is Devin Berkshire. I'm the Director of Conferences and Fieldwide Learning at TCG. I just wanted to introduce our speakers and offer a little context around this session. Full disclosure, this session changed forms many times and has just sort of recently gelled together with this actually really amazing group of panelists who, some of whom just came on. So I offer that because they have not all been in conversation with each other before. And this conversation is really self-moderated between them. As soon as I introduce them, I'm moving back and going off camera, and they'll take it from here. We are scheduled to stop at 5:45 Eastern, but Dr. Lee and some of the speakers are able to stay with us until 6. So if there are questions still happening, we can keep the Zoom room on and keep talking until then. But we may lose a panelist or two before then. I want to lift up Sam's dropping in the chat the Padlet we're using for this session, which is the place where we'll capture resources mentioned and where you can start to put your questions. Probably better there than the chat, but you can also put them in the chat. When we get to that part, Kristen and Big from TCG, who you just heard from, will help kind of guide our speakers with that. So these folks are going to be in conversation for a little bit after we hear from Dr. Lee, and then hopefully we'll have time to hear from some of you all with your questions. So I want to let you know who's here, and then I'm going to let them take the Zoom stage. So we're joined by Dr. Bruce Y. Lee, who is a professor of health policy and management and executive director of the Center for Advanced Technology and Communication in Health at City University, New York's School of Public Health. Did I get all that right, Dr. Lee? Then we have our friend, longtime friend, Kristen Marting, founding artistic director of Here Art Center here in New York. A well-loved downtown producing organization of multidisciplinary performance experiences. And we have with us Jill Cornell, who is a board member at Rockaway Theater Company, but also a community engagement specialist at New York City Emergency Management Department. And if I'm misstating anything, y'all please feel free to kind of jump in with your own intros when, as soon as I move back and correct anything or add anything to your bio. And then we have Stefan Wolfert, who is founding director of Decrute, but is also a theater artist who is happens to be trained as a trauma specialist in EMT, and is a current TCG Fox Fellow and has had many grants and awards for his mental health work with veterans and theater work with the incarcerated. Thank you all for being here. And I think a lot of folks are excited to hear from you. So that's when I stop talking. I'm gonna hand the mic to Dr. Lee, who's gonna offer around 5 minutes or so of context setting. And then I'll let y'all launch into conversation. Thanks, and Dr. Lee, feel free.
Okay, thanks, Devin. Well, I think it's quite appropriate that the lead in to this panel discussion was evolving and changing, because that's been the situation throughout this whole pandemic. You know, it's been an evolving situation. And I want to start off by saying that we're in a very, very different situation now than we were about a year ago. So we're now 15, 16 months into the pandemic. If you recall, this started in January, and the virus started spreading throughout different parts of the world, and it really started hitting the United States in February. And so we saw a surge in cases in March because we had some cases come over from Europe. And then that's really when things were declared a pandemic, and we really had a change in life as we knew it at the time. And at the time, we were facing a lot of challenges and issues. There wasn't any obvious treatments or any obvious vaccines available. So at the time, the key was to try to put the brakes on things. And if you recall, there was that term flattening the curve. And that basically meant trying to delay things, trying to keep the virus from spreading, getting out of hand throughout the country. And that's when everyone started introducing terms that maybe people hadn't heard of before. Those of us in the pandemic preparedness community were very well versed with these terms because we have been using them for years, but things like social distancing and then face mask use and those things. So progressively, those were layered on as interventions and ways of trying to put the brakes on the virus so that we can put together organized strategies to try to combat the virus. And one of those strategies was developing vaccines, because ultimately that was one of the end games, to find a vaccine that could help protect people from getting infected with the virus, from getting sick with the virus, and from spreading the virus. And I wanted to emphasize the central thing, which is getting sick from the virus. We can't forget that this is a virus that can cause lots of problems. So certainly there are some people who are fortunate and get infected with the virus and maybe don't suffer such serious medical consequences. But we also have to remember there's been a large percentage of people who've had to be hospitalized, and there have been deaths. But when you look at the death number, that really doesn't capture the full impact of what this pandemic has done, because many people have been hospitalized, they felt sick for long periods of time, and we know that there's something called long COVID, where people have extended situations where they continue to have pretty serious symptoms long after they are infected and long after they recover from the virus. So that being said, when we got to the end of December, a lot of hope sprung anew because we had the rollout of first the Pfizer vaccine and then the Moderna vaccine. And these were vaccines during clinical trials that performed even better than we anticipated. So if you recall, back in the summer, the FDA, the US Food and Drug Administration, was saying that we want vaccines that are at least 50% effective in terms of preventing severe COVID. Then suddenly we get this news that basically these vaccines are potentially over 90% effective. Of course, that may vary. But then they came out to market. They got emergency use authorizations at the end of December. And then soon afterwards, we got a third vaccine, the Johnson & Johnson vaccine. And then the vaccination program started. There were hiccups at the beginning. There were some stumbles at the beginning, but since late January, a lot of those things have been remedied. So basically, now we're at a situation where we have over 30% of the total population vaccinated, somewhere between 30 and 40%. And use of the vaccine is being expanded to not just adults, but now shortly we're going to have a lot of teens who are eligible for vaccination. What's happened to the pandemic? Well, we had a very tough winter. So December and January, we saw a lot of cases, but fortunately, some of those cases the case count has been steadily coming down. And that may be in big part because of the vaccines. Now, I want to emphasize that we're in a situation where there's a lot of optimism. We have vaccines available, vaccination rates are increasing. The case count has been coming down in many states, but we're still in a situation where the virus is still spreading, and there are these variants that are emerging. And these variants are maybe more contagious. And whereas the vaccines are effective against them, there might be decreases in effectiveness. So therefore, we just have to be quite careful. And so we're in a situation where it's encouraging, given the fact that the caseload is coming down and that we have vaccines on board, that we can now start moving into thinking about reopening places or maybe even reimagining places. And so there is a lot of optimism with that, but we have to combine caution with optimism. And that's basically where we're at. And when I talk about variants, that basically means strains that are a little different from the original strain, because this virus mutates a lot. There's a high mutation rate, as we say. And so there's a decent chance that new versions of the virus will emerge that may be more contagious or that may be more virulent, meaning they may be more likely to cause problems. And there is the chance that the vaccines at some point will be less effective against some of these strains. That's why we have to stay vigilant and stay cautious and really move in a way that we're reimagining how life is, and we can and we're moving towards quote unquote getting back to normal. But at the same time, we want to ask ourselves, how can we improve upon what things were like before the pandemic. So I think the pandemic is really giving us an opportunity to say, how can we look at the things that we probably should have fixed in society, or some of the things that we probably should have taken care of before, but the pandemic really uncovered some of these issues or problems. So it's a great opportunity to really say, not only how do we deal with this public health emergency, which is still an emergency, but how do we reimagine everything? How do we do the things that we've always wanted to or should have done? So if you look at the 2020 was a way of really stripping the covers of a lot of the issues or problems that exist in society, whether ranging from equity issues to problems with the supply chain, to problems with the healthcare system, to maybe issues with terms of the environment or clean air, or all those different types of things. So I think this really gives us the opportunity to have a great conversation about not only how do we deal with the current pandemic, but how do we reimagine things, and how do we make society, and the arts are a huge part of society, how do we make the arts and society better? And how do we improve on everything? And how do we basically help each other? So with that, that's the a quick overview. Hopefully that gives us a little context, but I'm really excited to engage in this conversation, because whenever I talk about things, I always learn, and I always learn from the questions. I always learn from the people that I talk with. So with that, Kristen and Stefan, I guess we're going to embark on a conversation, and we'll see where it takes us.
Thank you so much, Dr. Lee. I think one of the things that you touched on in your presentation for us to think about is the complexity of how we care for everyone in this moment, and how we have folks that are vaccinated, folks that aren't comfortable being vaccinated but have negative COVID tests, folks that have medical issues, folks that have distrust of the medical industry. There's a whole spectrum. So what are the recommendations that you're making about how we care for that broad cross-section of our family and our community in a responsible and safe way for everyone?
So great question. So when vaccines were first rolled out, it started following, vaccine acceptance started following your typical technology adoption curve. So there were people at the very beginning who had been waiting a whole year for vaccines. And this includes people who were on the front lines, healthcare workers, because they were putting themselves at risk every single day, and they didn't have personal protective equipment. And in many cases, they didn't have the masks that they wanted. Later they got them, but still they were struggling, and they were anxious to get the vaccine because that was their protection. So then you saw the curve go up, and then you saw people who maybe they didn't want to be the first in line, but they were very excited about getting the vaccine. So at the beginning, it was actually tough to get enough people vaccinated because there were long lines, and demand outweighed supply. So then you have basically this S-shaped curve where things shot up, but now we're in a situation where there's a little more leveling off, because a lot of the people who really wanted the vaccines initially have gotten them. Hopefully there's still people who are waiting, but now we're in a situation where there are people who are more vaccine hesitant. And those, they can be broken down into different categories. So one are the folks who, they may not want to be as early on, and they just want to see what's going on and just get a little more comfort in terms of seeing the information and basically understanding the vaccine. And so that's just a matter of time, because each person has their individual comfort level where they say, okay, I want to see X number of people around me get vaccinated before I want to do that. Another group are people who are harder to reach. They don't have ready access to the healthcare system. So they might be located in neighborhoods, like rural neighborhoods, who are very far away from vaccination locations, or lower income neighborhoods where they're not next to a health clinic or something of that sort. And that's more a matter of how can we get the vaccines to them or closer to them. Then there are people who are hesitant because they have questions, or they need more information, and they want to see the scientific information, and it's there, but maybe someone hasn't really kind of digested for them, because there's all these messages out there, and it can get very confusing. So for everyone who's in that quote unquote camp, we want to encourage them to try to seek out information. You don't want to be in a situation where you get something and you don't understand what it's actually doing. So it's important to feel comfortable about that. And then you mentioned, Kristen, people who have distrust from of the healthcare system. And that's natural because we've had inequities and disparities in healthcare for so many years. So to expect people to say, hey, okay, yeah, I'm going to trust the healthcare system today, despite all those, it's like a bad relationship. Like you don't want to sit there and say, oh, okay, now I trust you. So there's a lot of healing that needs to be done to work with people who don't have trust with the healthcare system. And so I would say we have to remember, of course, the benefits of the vaccine are twofold. One is they protect you as a person, so you are less susceptible to bad COVID outcomes if you get the vaccine. But also the other purpose is to prevent you from getting infected and then spreading it to others. So the effectiveness of the vaccine for you depends on not only yourself, but how many people around you are vaccinated. Because if everyone around you is vaccinated, then the virus can't really find someone to infect. So therefore, it's hard for it to spread. So think of people as parking lots, right? The virus is trying to park itself in one of the parking lots. And if the virus can easily find parking lots, it can continue to spread and multiply. However, if there are fewer empty parking spaces, then the virus can't spread. So therefore, your protection also depends on everyone else's protection, because the vaccine is not 100%. It's very good, but you can still potentially get infected, but the effectiveness goes up. So we want to help everyone understand that it is not just a matter of you getting vaccinated, but like it's people around you. And that's the goal, is to try to keep the virus from finding people to infect. So it's a community group intervention and not just an individual one. But again, you don't want people to feel like this is something that they're being forced to do. It's always important to help people understand the reason and the scientific rationale for all these things. So hopefully that addressed your question.
I see there are a few questions in the chat. Do we want to defer to those at the moment? Sorry.
I think that we can all chat, and then around a little bit through the session, we'll start taking the questions in the chat. Did you have something you wanted to say, Stefan?
No, my internet is having an issue at the moment, so I'll defer.
Okay, well, let us know when you want to jump in when your internet starts cooperating. But I think, Kristen, you asked a great question, because we're in a situation where we haven't seen the full effect of the vaccination programs. When you're between 30 and 40% of the population being vaccinated, that might slow the virus from spreading, but it's still actively spreading right now. It's only when you really get at least the majority of the population vaccinated, that's when you really see changes in the virus spreading. And people talk about 75% herd immunity threshold. And that basically means that if you reach that 3/4 level, where at least 3/4 of the people around you or more are vaccinated, then the virus really runs out of options. And that's when you start seeing the virus spread plummet, because the virus, again, they can't find those parking spaces. And that's one of the reasons why you hear on the news public health experts like Tony Fauci and other folks repeating that herd immunity threshold, trying to get up to that number. And that's the rationale behind that. So again, we have to remember there's two things: protecting yourself and trying to find some way of really reducing the spread of the virus. When you really reduce the spread of the virus, that's when things can really change. When you can say, hey, we may not have to continue to do these different types of measures. Right now, if you're vaccinated, you still need to be careful. You still need to try to social distance where you can. You still need to try to keep good ventilation, be outdoors if possible. And it's still good to wear face masks, because you can still spread the virus. If you're vaccinated, you can still potentially acquire the virus. The chances are a lot lower, but you can still carry the virus and still spread others. That's the reason why everyone's saying, still, you need the social distance. You still need to wear masks, even if you're vaccinated. So we're sort of in that gray zone where things are getting better, but we still need to be cautious as well.
I'd love to ask a question right now about sort of the phase of vaccination that we're at with the vaccine is now widely available in New York City. I know we have lots of folks from all over the country here, so I'm looking forward to hearing what the situation is in other parts of the country. But in New York City right now, we have wide availability. We just opened up to 12 to 15-year-olds, which is going to have a great impact for high school students. And for families traveling, et cetera. This part, it's starting to get very tricky about encouraging people to take the vaccine because of the vaccine hesitancy. And one of the, I've read different articles. I don't know if you're working with that, Dr. Lee, but I attended a motivational interviewing session where they talked about it, where it really, the challenge now is to really have deep, caring conversations with people who are taking their time, like even calling it vaccine hesitancy. As you mentioned, there's a wide range of reasons why people aren't taking the vaccine, and learning how to listen to what people's concerns are is really important. So I guess that might, that could be credited to sort of a positive aspect, like maybe we'll become better listeners, which is really important in all kinds of communities, you know, certainly in underserved communities as well as overserved communities. We could all stand to be better listeners. So I'd love to hear whatever you have to say, or what your thoughts are, or what research you've read about this phase of how to go about encouraging people to take the vaccine.
Yeah, great comments, Joe, and great question. In our society, we have a tendency to lump people together and label people and say, oh, everyone's in this group is the same, and everyone in this group is the same. Okay, there are 2 groups or 3 groups, and it's one versus the other, et cetera. When in actuality, it's a real spectrum of people of different backgrounds and different situations, et cetera. So it is really important to really understand people's situations. And we have to, you know, picture this. If you were to take a bunch of things and go to any neighborhood, say go to some really wealthy neighborhood and sit down there and say, okay, you know, I want to give you these things. And people will be like, who are you? You know, why did you land in my neighborhood? I don't know you. Then they're not likely to take what you want, whereas want them to get. But if you're in a situation where you already know people and you can talk to the people that they know and they feel comfortable with you, then they can understand that, oh, you're trying to help them out. And so one of the keys is to really reestablish the social fabric, to help people around them and help communities and neighborhoods feel like that they're actually part of this decision and they're part of trying to protect each other. So what you want to do, you know, there's a lot of studies that have shown that people tend to do something when people around them are doing something. So whether it's their friends, family, colleagues, coworkers, because they know who they are and they know what their motivations are. So one of the things that needs to be done in this next phase of the vaccination program is outreach, to go out to communities and really communicate with people, find out what their concerns are, find out what the issues or challenges that they're raising, and what's even more important is getting the communities and neighborhoods actually involved with the vaccination program itself. Because one of the problems, and this especially occurred last year, is you see leaders making decisions, political leaders making decisions, and people might say, hey, I don't see people from my neighborhood up there, or I don't see people that are like me, or that can relate to my situation. I see people who are just very different from me or don't really represent me, et cetera. That's very different versus saying, oh, you know, I see someone that can relate to me. I see someone who's making decisions, who are running these programs, who I feel, you know, we have a shared heart, or we have a shared experience or background or understanding or perspective. That really changes your viewpoint of programs like this. So really getting people more involved in these vaccination programs, where they're actually handling and sort of leading aspects of these programs, I think is really important. And then you mentioned that we are really at the cusp. I mean, the CDC basically just gave their recommendation, and we just saw FDA emergency use authorization for people who are 12 to 15 years old. That's another question. People are saying, oh, why do we need to get younger adults or kids, teens vaccinated? They don't seem to have as a high probability of having bad effects from COVID-19. Where there's two reasons for that. One is, sure, they might have a lower probability, but it's not zero. You still see younger adults, you still see kids, or teens, et cetera, potentially suffering bad outcomes from COVID-19. The risk may be lower, but the chance is still there. And we're actually seeing an increased probability, in recent months, maybe because of the variants spreading, the more contagious and potentially more virulent variants. But the second big reason is younger folks tend to be more super spreaders. Because if you think about it, think of teenagers. They'll congregate, they'll mix with each other, they go all over the place. You don't know what they're doing, what they're touching, who they're touching, et cetera. All of us remember high school can be kind of chaotic, and junior high can be kind of chaotic. So therefore, it's harder to maintain those distances. It's harder to maintain those other precautions. And then what teens may do is then they go back to their homes, and they may interact with their parents and grandparents, and they potentially can bring the virus back, et cetera. So there's a big public health reason to get everyone vaccinated, not just the people who are at higher risk for severe outcomes. So we have to remember these things.
Yeah, this is great. I would love to pull us into some stuff. I have one more kind of global question, but it'd be great to go into the industry. A lot of people are asking a lot of very specific questions about our industry and your perspective on it.
Mm-hmm.
But one of the things that I think hits our industry really hard was the CDC's announcement today that vaccinated people can mostly go without masks in many situations. And I'm curious if you have any concerns about that as a doctor, or what your advice would be about how that relates to theaters outside of the union issues, which are a different thing, but just your perspective as a medical professional on the CDC's decision.
Yeah, so the rationale is that if you're amongst everyone who's vaccinated, then all of you have a much, much lower probability of getting sick from COVID-19, and probably a lower probability from getting infected with the virus. So the thinking is that if everyone's vaccinated around you, then the risk is lower. Then so potentially, if you're a lot less likely from carrying the virus, then maybe you don't need the face mask to block the drops that are coming out of your mouth. That being said, we have to be careful, because we are seeing situations where people are not being truthful about their vaccination status. We're seeing things like even these counterfeit or fake vaccination cards that are coming out. There was an article where someone said that he was able to get a vaccination card on Etsy. And so you see these situations out there, or there's these groups which show you how to make these vaccination cards. So we're at a crossroads. We have to be very careful that it would be one thing if everyone were very straightforward in terms of their vaccination status, and then they were to say, okay, great, you've chosen to get the vaccine, and therefore you're at lower risk for carrying the virus, et cetera. So that's one thing. But if you chose not to, that's your choice, but you still have to then be careful, because you might infect other people, et cetera. So if we could draw those lines, things would be a lot easier. But we don't really have a situation like a vaccine passport situation where it's very clear there's an official record to see who's been vaccinated versus not. So you want to be careful about that, because if you run a theater, for instance, one of the last things that you want is an outbreak in your theater. That's going to set you back quite a ways. So not only are you going to put people in the theater at risk, but also if you don't want to be on the headlines, right? You don't want to be that theater that say, oh, there's an outbreak at this theater, because that might affect future patronage and people going by your theater. And we've seen in the case with like restaurant outbreaks, even before COVID-19, like if a restaurant will have an outbreak of like some type like norovirus or some type of food poisoning, that really affects their business for a while. Because people just associate it with that business. So you want to be careful about that. So I would say when the CDC comes out with some of these relaxations of guidelines, you have to remember why they're doing this. They're doing it because they want to give a little more leeway to certain organizations and businesses to do things if they want to do certain things. But you also have to remember, keep in mind your own business, your own situation, and what are the potential risks for your own situation. So hopefully that addresses your question.
I have a question, Dr. Lee. Excuse me. This year, my wife and I, Dawn, were fortunate enough to visit both Syracuse Stage and Cincinnati Shakespeare.
Mhm.
And the thing we were most impressed with, they can't have people, audience yet, is that at every doorway there were signs, and bear with me for anyone groaning, going, "Oh God," but there were signs to say there was virtually or literally an agreement that to go past this sign, I agree to wear a mask, sterilize my hands, and they had all of these materials at literally every door that you went to, so that to touch the handle, there were wipes, and then the sanitizer immediately after. Obviously, these things all reduced, but that requires a significant amount of money, I imagine. Is there anything for the smaller theaters that want to open, that want to do this safely, that want to do something along those lines? Is there any place where they can get these resources if it's outside of their budget?
Yeah, so that's a challenge. That's a question. There's some places which have larger budgets where they can do a lot of these bells and whistles, but we have to remember that there's a difference between things that are for show and things that you really actually, are really important. So we do know that spread, the primary spread is through like droplets, and that's the reason. So there's several reasons why you do the social distancing and face masks. So one is the 6 feet is for larger droplets. So if you've ever seen those videos, and you want to warn yourself before you watch these videos, but they show people coughing or talking or sneezing, and you basically see this like geyser of droplets come out. And a lot of these droplets are heavier droplets, and they do an arc. So it's almost like catapulting it out, and then it drops to the ground because of gravity. And they tend to drop to the ground within 6 feet. And that's the reason for the 6 feet specification. But then what was found out last spring was that the stuff comes out, but then you also have some stuff float up. And these are smaller droplets. These are much lighter droplets. And that's called aerosol. So they're like small droplet aerosol spread, and those can contain viruses as well. And those are the things that can travel past 6 feet. They can fill the air. So if you have people talking or singing or what have you for a while in a room, you've got to, sure, you have those big droplets coming down, but then you have those lighter droplets floating in the air, and they stay in the air for a while. So those ones that stay in the air, it's distance won't help with that because they'll float around. That's why the face masks became an issue, because we want to block those from coming out. Now, the other way you can really deal with them is through ventilation. You can have filtration devices and HEPA filters and those things that can ventilate the air. So when we talk about sort of the big ticket items, the things that you really want to focus on, you want to try to get people to social distance when possible. You want to get people to wear masks. You don't necessarily have to remind them every single step of the way, but as long as there's sort of general, at the front, wear masks and a reminder of those things. But the other thing is you want to look at the air. Are you in a situation where the air is very stale, there's very little air exchange, and there's no filtration? Well, that's one of those things that you want to probably try to focus efforts on to try to improve that. Now, the question is, if you're a smaller theater and you don't have the resources to buy or, to overhaul your ventilation system, yeah, that's a challenge. So you may want to contact the local public health department, especially if it's a larger one, to see if there's any way, the larger public health departments they might have an environmental health specialist or those things like that. And they can either you can either see how they can help or see if they can connect you with someone who is willing to provide some kind of service or some kind of discount rate, because the arts are a big thing. And the great thing about the arts is not only do they provide entertainment, intellectual stimulation, etc. People have an emotional connection with the arts. So if you reach out, you might be able to find folks who are willing to say, hey, I want to see the arts return. Therefore, we can work together to try to find ways to improve the ventilation in your theater. I have seen situations where people are willing to do that because they understand it's sort of a give and take situation, where if they can help out the arts, also they've established a relationship or a client with you. So they understand that going forward that they can be your business of choice when it comes to ventilation issues. So there are ways to cope by reaching out, but I would definitely suggest reaching out.
Thank you. I want to plug in there too that it's not just that theater matters mentally and emotionally and for the community, but we're actually bigger. We add more to the GDP of the nation than agriculture. So when we're arguing about this, about getting the PPE or getting the equipment and the resources we need, I think if we come together and really argue that we are essential, at least to the economy, if they won't see us as a part of society. But I just want to put in that plug. Thank you for that.
Yeah, absolutely. I think one of the key things that we have to keep in mind is there's certain industries that have very hard numbers, and they show, okay, yeah, we do this to the economy, or we affect trade in this way. But what we found with different studies, and we work with the sports industry as well. And this ranges, the sports industry, it can be very similar in many ways to the arts. You have sort of professional level sports that have more resources, have more exposure, but you have the whole spectrum. You have youth sports leagues, you have in-town leagues and things like that. And one of the challenges early on during the pandemic is coming up with suggestions. And I'm part of a consortium that includes the NHL, NBA, Major League Baseball, and all those major sports leagues. There are big questions at the beginning. What should sports leagues do? What should the pro sports leagues do? What should smaller youth sports programs do? What should sporting arenas or gyms, big and small, do? And prior to that, we had also done work with the sports industry showing the impact of sports and physical activity and those things, and the impact was significant because you get people active, you get people engaged. It also helps people feel better. It helps with mental health, all those different types of things. So you can apply a lot of those things to the arts as well. The impact of the arts is significant, and we're really seeing it over the past year. I mean, people don't miss something until they actually have to miss something. So I think also the more that everyone can impress upon policymakers and local leaders of the impact that you'll have if you are able to open safely. That's the key. If you're able to open safely, you can have a very positive impact. There's lots of people there waiting to see the great stuff that you have to offer.
There's a bunch of questions that people are asking that are around having relationships between staffs, artists, and audiences, and what the different levels of need and protocols are. I've heard some legal advice from folks in the recent week or so, but I'm interested if you want to help us with this. A question of what is an individual entitled to in terms of their privacy versus what as an employer can you request of an individual, and in each of those roles, because I understand there are different definitions about whether that's an employee, that is an artist, or that is a audience member.
Yeah, so I think things are different if you're a business and you're offering a service, and so there is historical precedence for requiring certain precautions or certain things if you want to work in a location, or if you want to partake in the services or the products that a business or organization offers. So we've seen this when it comes to like Costco or where, customers who are refusing to wear masks are asked to leave, or there are requirements on employees to use certain types of precautions to wear masks, etc. So there is precedent for those types of requirements. We have to remember that when you, so there are multiple components in any organization. There are the people that work within the organization permanently. There are people that come in and out, and then there are customers or theater goers or what have you that come in and out. It doesn't matter when it comes to the virus. The virus won't distinguish, say, oh, you're a staff member, therefore I won't infect you. Oh, but you are a theater goer, maybe I will infect you. No, as long as there's people that are bringing the virus into the setting, then that raises the risk of an outbreak, and that puts everyone else in danger. So when thinking of protections, you have to think about everyone. How can you either, and there's really only several options. So one is there's the vaccine. Two is keeping people separate. Three is people wearing face masks. Four, of course, is disinfecting and hand washing and those things. And five is the air. So those are things that you have to worry about. So I would say, of course, certainly you want to check with legal advice and what the situation is, but the precedent is that, yeah, many businesses do have certain requirements because they're considered potentially endangering others if you don't take certain precautions.
I was advised that you can require vaccination for everyone and have that be a blanket policy. And if the individual it attests that they're vaccinated, that you are taking their word for it, that you don't have the right to see it, but you can ask for it. You can ask for it, but if they choose not to provide it, that's within their privacy rights. Or you can also have a policy where you're asking people to either be vaccinated or have a recent COVID test, and to provide an assurance of that. But again, you can't see the results of the COVID test to respect their medical privacy. Or you can require nothing but keep people masked and socially distanced. This isn't in a union context. This is from an individual rights perspective for those different classes of folks. For audience, you don't have to request it, but you can request it, and then you can decrease your social distancing rules because everybody's fully vaccinated if you go that route. But then you're excluding some folks. So one of the things that we really don't want to be excluding folks, but we want to keep people safe. So one of the things we're thinking about is maybe we will have fully vaccinated performances, and then performances that are not fully vaccinated, that are socially distanced, so that everyone can feel included and welcome at our facility. So that's like one thing that we're thinking about. And we're going back to discuss that to make sure that we're following the right protocols by doing that.
Yeah, and that's certainly an approach that's worked in other industries where they strike the balance to say, okay, we're not saying that there's one option. There are at least two, maybe more options if someone's not taking the particular precautions or not getting vaccinated. So you're not completely denying an opportunity to people, but you're clearly saying that, okay, we have to take different precautions. We have to be, so you have an obligation not only to individuals, but also to the broader public or the broader group of theater goers to try to protect them as well. So that can be a balance that's struck.
And I want to just add something that's become much of the public health messaging. And in light of the fairly recent super spreader event that happened upstate with the dance competition, I'm sure many of you followed that, but people came to and kids came with their parents, came to the competition sick. And 300 young people, and it went like wildfire. Yeah. Throughout this community, and I think the number of people quarantined was something about 300. I forget how many were sick. So I think that the show must go on. That old adage has to be retired, because we have to encourage audiences and performers and staff to stay home and take care of themselves when they're sick. And that also kind of, goes into some workplace considerations because, gig workers are not always covered when they're sick, right? So how do we have to really change that. That's that fundamental value. You've heard so many stories of, well, I was puking my guts up, but I went on and I sang the song. That can't really go on anymore.
Yep. We've done studies in the past that have shown when it comes to the restaurant industry, like if you have someone who's sick, they should be encouraged to go home, because you get one person who's sick and they're working in a restaurant, they can quickly spread it to others. So we're not just talking about COVID-19. Again, we're talking about things like norovirus and other types of infectious diseases, and that can quickly cause a problem. And the COVID-19 coronavirus is even more contagious than those things, many of those things. And also to address something that Kristen said, and another question that I saw in the chat, it is true that there are school systems and university systems that are now requiring vaccination to return to class. And they have a system in place where, in many cases, where you actually have to log on to the system and then provide some type of evidence or proof of vaccination. Now, some of these schools are saying that people who are not vaccinated can still do distance learning and partake maybe in things remotely, but they can't come onto campus. So you can also look at what some of the universities and some of the schools are doing to get a sense of what might be possible.
Go ahead, Jim.
Oh, I just wanted to thank Dr. Lee. Yeah, that's a great observation.
I'd love to, I'm going to shift a bit, and if this is out of your purview, by all means, let me know. But my concern is concurrently with this. Even if you can dare put aside for a moment the vaccine hesitancy and all of these existing problems, just getting out of the pandemic. As we go forward, my main area that I work on concurrent with theater is dealing with trauma. And we now know that not only trauma as in the mind, but we know, and I'm going to put this up here, Gabor Mate has a book called disease. For example, uses Lou Gehrig's disease for children who are caregivers at a young age and then later in life develop Lou Gehrig's disease and what have you, racism, heart disease, and so on. My concern here is obviously if we pull out of this COVID, the long-term mental and physical health effects of this. And I'm wondering if this is being discussed in the planning as we go forward is there a comprehensive plan to actually address the mental health and psychological strain that this is causing as well?
Yeah, great comment and great question. There's a lot of scientific evidence that links emotional and mental health to physical health, and even things which you might think are separate are actually many times linked. There's links between heart disease, emotional health. It may play a role in cancer. It may play a role in different types of non-communicable diseases. There's the question of the relationship with the immune system. So there's all these different possibilities. So we do know that emotional, psychological, mental, physical health are all intertwined. And so the pandemic community for many years has been discussing the impact of not just a pandemic, but also the interventions and policies that need to be put in place. So during the 2009 H1N1 pandemic, our team was stationed in the US Health and Human Services to help with the national response. And early on, and many people may not realize this, early on, some of these social distancing measures were considered. And so this was in the spring of 2009. And so we were running some simulation models to say, okay, what happens? The CDC was interested in saying, okay, should we close schools? And we ran simulation models to show, okay, this is what happens if you close schools, and this is how long you would need to close them to be able to really make a difference with the pandemic. And it was a very long time. And we also calculated the costs and expense when it came to not only like lost productivity, the lost teacher productivity, but some of the impacts that you mentioned, and it was huge. So the decision at the time was, okay, not worth closing schools. Then, no one really heard about social distancing. So the general public could have heard about this maybe about 10 years prior, but they didn't, because these decisions were made to not go ahead. That being said, there needs to be more consideration of these things. There needs to be more consideration of like, how are we going to rebound as a society from all the trauma that we faced? If you think about it, okay, there's step one. You may have known someone who passed away because of COVID-19. That's direct trauma. Two, you may have experienced COVID-19 yourself, and anyone who have experienced it, it's not a pretty sight. You can go up and down, and it can be quite harrowing to have as an infection or a disease. That has its trauma. Three is people have long COVID. They continue to have symptoms or problems. You have people having anxiety and headaches, and even more severe mental health challenges long after they've had COVID. But beyond that, we've spent a year seeing people die. We've spent a year seeing these death rates go higher and higher and higher. We've seen a year in which we haven't been able to do the same things that we wanted to do for many years. Many people have been caught alone in their homes and things like that. So there's all these issues that really need to be addressed. And the concern right now amongst many of the medical and scientific community is that systems aren't in place to really help people cope. There's articles recently talking about healthcare workers, for instance, healthcare personnel. They've been going at it for like 14, 15, 16 months with almost no break. Like, what about them? Everyone has a breaking point at some point. So these are real concerns. Now, that being said, there have been studies, and I want to also look on the optimistic side here. There have been studies looking at past epidemics, like the 1918 flu pandemic, for instance. And they've found that in subsequent years, people who were caught in the middle of that actually did really well. Like people, especially in teens and young adults, like people you feel that they would be knocked off kilter because of this. And what they found is that being within a pandemic helped people understand that life can change at any moment, and that you actually have to be adaptable, and that you really can't count on tomorrow or the next day. And it's built resilience. So the question is, how do we hit that sweet spot where we use the pandemic as a way to help learn about ourselves and help learn to improve society and be adaptable, but at the same time, be careful about people suffering trauma and not being heard and not being treated and not being taken care of. So I think if we can do that, then we actually emerge with a stronger society. Like I've said, over the past years, we've seen a lot of problems uncovered that were there all along. So if we can find a way of really moving forward and saying, hey, the pandemic really helped us focus on some of these issues or problems, then I think we can be a stronger society. But that's a good question and something that we need to beat the drum on throughout. So, hey, pay attention to everyone. Pay attention to everyone. How can we take care of all this trauma?
When you look at where we are on the vaccination rate and vaccine hesitancy and the variants, do you still feel like it's a good idea for theaters to be opening this summer and fall?
Well, so I guess I can give a multiple part answer to that. So one is, so the summer, if we see cases go down, the summer may be helping in the sense that, when the weather changes, when things get warmer, when the air gets less humid, that may actually bring down transmission of the virus, because there's been studies that have shown that respiratory viruses like this virus have a seasonality. So if you think about, flu season is usually in the winter seasons. And so we saw the surge in December and November. And at the same time, we may see like a decrease. So that may make the summer months a little safer. So we have that going for us. But of course, the concern is, will we see another surge in the fall or winter? So one of the things that we want to try to do is get as many people vaccinated as possible by the summer so that you have protection for the winter and fall. That being said, since transmission is still fairly widespread, you want to be careful and you want to proceed gradually. And you want to make sure that if you move too quickly, people may forget to maintain different types of precautions. So what you want to do is you want to still proceed slowly, see what's happening in the community around you in terms of the spread of the virus, and make sure that you maintain precautions. I wouldn't go full bore and just say, okay, just open up, we're back to normal, because that's when trouble occurs, because people can quickly forget that we're still in the middle of a public health emergency. So everyone's individual situation is different. So it's hard to come up with a blanket, say, oh, you shouldn't open at all. That's not a good idea. But of course, that's the safest thing to do, not open. But on the flip side, everyone has their individual situations, right? You may not be able to afford to stay closed all that time. So what I would suggest is several things. So one is, if you're going to do anything, do it gradually. Two is, do it with advice from a public health expert. Do it with advice, with guidance from someone who says, okay, I can see your situation. Let's take one step further and then see what we can do. It's the same thing. I would view public health experts or medical experts just like you would a lawyer, right? So you don't do anything before checking to see, okay, legally, what does this mean? What are the implications? What could happen? And I say the same thing with public health experts. What can happen if I do this? Okay, what's my situation? Did you check out my ventilation system? Oh, your ventilation system, not good. Air's too stale. Well, in that case, you probably don't want to open. So there's different things that you really have to check.
There's another question on the Padlet that is around how nonprofit theaters at the intersection of social justice and community can better hold audience members who might be tentative about returning to theater mental health wise. Do you have practices or tools that you think we could adopt to start these conversations and to have them effectively?
So let me see if I understand the question. Is the question if people want to return but they're hesitant to return, or?
Yeah, I mean, I think a lot of us really worry that we're going to open our theaters and we're going to be observing safety protocols, and we're going to be trying to reassure everybody that this is a safe place to be and that no one's going to come. So I think that's the fear that is at the root of our industry, is we just don't know how people are going to react to this time.
Yeah, we have to keep in mind that, Stefan, you mentioned trauma. So people have been facing trauma and they've been facing difficult situations. I was talking to someone I know the other day, and that person went to outdoor dining for the first time in a long time and said it just felt weird. Just said, I did this all the time. This person is very extroverted, and I did this all the time. But then I went there and it just felt weird. And I looked at people and said, I don't know if I want to even be in the same place as you. So we have to remember, well, people react very differently because there's been a quote unquote new normal all this time. So how do you address situations like that? Well, you address things gradually. So you can't, and you also have to go in without expectations. You can't say, okay, things are just like they were a year and a half ago. No, things have changed. The analogy is like, say you had a relationship with someone for a long time, and then something happened and you broke up, or you're apart for a year, and each of you sort of grew differently during that year, and now you're reuniting. You won't immediately go back and say, okay, it was just like it was before, and everything's the same. You would approach things a little more cautiously, and you have to understand and communicate. Okay, say, how are you feeling about things? How have you been over the past year? What's changed? So I would say, reaching out to the potential audience, trying to feel their concerns, seeing what their safety levels are like, and reassuring them, and finding ways to actually gradually get them involved. And this is what's happening with sports as well. So if you look at a lot of the sporting leagues, so there's professional sporting leagues as well as the, the more local leagues, they've done things, including throughout the pandemic, to keep people engaged. Like for instance, if you look at the US Tennis Association, they had videos on, how to play tennis by yourself, and how to hit things against the wall, or how to do drills at home. And they've shown these videos where they have different tennis players do these drills with people, et cetera. So it's keeping people engaged. And other sports programs have done that. So if you can think of ways to start engaging the audience in ways that are safe, say you might want to do some type of performance outside, maybe like a brief performance where people can feel like, okay, I'm interacting again. I'm watching a production, but it's outside and we're all completely separated, and you've got the wind and the big natural fan out there blowing things around. And then you start moving closer towards really re-engaging the audience. And the other thing we have to keep in mind is the more that you can show that you really care about public health measures, the more reassuring you can be. Throughout 2020, many public health experts have emphasized the road to economic recovery is through public health. The better you can control the virus, the sooner businesses will be able to return, and the sooner people will feel more confident. So you want to remember that you need to re-earn the trust of those who are going to be visiting your theater, because it's not just a sort of, here's a service and they take the service. It's a relationship, right? You're trying to reestablish a relationship with the theater goers.
I want to hop on that if I may. As I know we're reaching the end of our time. First of all, on behalf of all of us, thank you for your time. And I want to put in a plug on behalf of, no one knows where I'm about to do this, but I mean this sincerely. I would love to put in a plug for you and all of the folks, in addition to our thanks of working on this, to include us as part of this. We keep hearing this theme of how do we reach the communities? We're one of the ways. If we had the resources, we could open up the theaters to socially distanced town halls that are simultaneously put online and put out to that community. It's very regional and specific to localities, as well as nationally, to help not only disseminate information, but then, dare I say this, experiment, create a plan, try it, stay in constant communication. But I think we're actually a resource that could be an underused resource in treating this pandemic, and not just using the use of space, but the use of the theater professionals in different facets outside the theater, and then coming into our theater and using it. So I just want to use this as hopefully as a leaping off point to continue the idea of us being a possible resource going forward.
That's a great point, Stefan. In fact, I was talking to the media the other day, and they were talking about what's the next phase in vaccination. And as I mentioned earlier, it's outreach, and it's finding ways to connect with people. And then I gave some examples, and among those examples, I say, well, you might want to get churches involved, get schools involved, and get people vaccinated, et cetera. And I mentioned theaters as well, because these are the things that people connect with. This is the pulse of a community, the pulse of a neighborhood runs through all these different things. It runs through sports, it runs through the theater, it runs through arts, because that's what moves people. And so, yeah, I think it's great to have theaters as potential vaccination locations. It doesn't even have to be in the theater, it can be outside the theater. You can have theater personnel helping with those things, because whenever you have vaccination location, you need people to check people in. You need people to, how from after they get vaccinated, sit down and just check to see how they're doing and things like that. And then, we've seen situations where, like, for instance, you've got NBA stars like the Dikembe Mutombo, for instance. He went and got vaccinated himself, and he specifically chose a university down in Georgia. Of course, he can go anywhere he wanted, but he specifically chose University down in Georgia because he felt that it would have good outreach to Black Americans who are in Georgia, and to show, hey, look, I'm getting vaccinated. That's the same thing with theater goers. You know, think about it. They see someone like, oh, I saw you on stage, and hey, you're wearing a mask and you're getting the vaccine. That can have a whole lot more impact than some policymaker far away saying, oh yeah, you should get the vaccine. So good point.
Thank you all. That would actually be a really great place to close. There were a couple very specific questions that were mentioned on the Padlet that we were not able to get to. So as I mentioned in the chat, for those of you who didn't see, I think TCG will work with either Dr. Lee or other medical advisors to get those questions answered, and we can put our best answers onto the Padlet, and that Padlet will be accessible for a bit after the conference. So that Padlet is linked in the session description. It's also been linked a bunch in this chat. Dr. Lee and Jill and Stefan, and even though Kristen is not here, Kristen, thank you so much for making time for this. You're getting a lot of gratitude in the chat. And it looks like this conversation could have gone on for much longer. So I think that's a signal to TCG to provide more space for conversations like this, because folks in our field have a lot of questions. And Suzanne and Rodney, our ASL interpreters, wow, you guys are just fantastic. Thank you so much, everyone. Dr. Lee, we really appreciate you being here with us. Anyone has any more questions, as I said, you can put them on the Padlet and we'll try to address them there afterwards. But check your messages for end of day messages from TCG, and have a wonderful evening, and we'll see most of you tomorrow. Thanks again. Oh, and I'm sorry, one more thing. Sam, I think, is dropping the link to our feedback form. Sam, if you could drop that again. We did it once when the session was meant to end, and we'll do it again now because we had a lot of people stick around. So we'll leave the session open for one more minute for that to happen. But thank you again. I'm going to sign off now, and you are welcome to do the same.
Thank you, Dr. Lee.
Thank you, Stefan. Thank you, Devin.